10 blood tests everyone with type 2 diabetes should get. What if your diabetes blood sugar looked normal, but silent damage was still happening inside your body? Most people with type 2 diabetes only check 1 or 2 blood tests, but doctors actually rely on 10 critical blood tests to catch hidden complications before they become dangerous, and one of them can detect kidney damage years early. Let's break them down. If you have type 2 diabetes, you already know about checking your blood sugar. But diabetes doesn't just affect glucose. It affects your heart, kidneys, liver, nerves, and even your vitamin levels. And the tricky part? Many complications develop silently. No pain, no symptoms. Until one day, something serious happens. That's why doctors order specific blood tests to detect problems early. Today we'll go through 10 essential blood tests every person with type 2 diabetes should know about. And number 7 is one that many people skip, but it can prevent nerve damage and memory problems. Let's start with the most important one. 1. Hemoglobin A1C. The first test is Hemoglobin A1C, often called HbA1c. This test tells you your average blood sugar over the past 3 months. Think of it like a long-term report card for your glucose levels. Here's why it matters. Blood sugar sticks to your red blood cells, and since those cells live for about 3 months, the A1C shows your overall glucose exposure. Doctors usually aim for below 7% for most adults, sometimes below 6.5% for younger patients. But here's the surprising part. 2 people can have the same daily glucose readings, but very different A1C levels. Why? Because spikes after meals can raise A1C even if fasting glucose looks fine. And that leads to our next test, which catches something A1C can miss. 2. Fasting blood glucose. The second test is fasting blood glucose. This is the test done after 8 to 12 hours without food. It measures how your body controls sugar when you're not eating. Healthy fasting levels are typically 70 to 99 milligrams per deciliter, normal 100 to 125 milligrams per deciliter, prediabetes 126 milligrams per deciliter or higher, diabetes. But here's where things get interesting. Many people with type 2 diabetes wake up with higher blood sugar in the morning even if they didn't eat anything. This is called the dawn phenomenon. Your body releases hormones early in the morning that raise glucose levels. If your fasting sugar is high every day, it may mean your medication or insulin schedule needs adjustment. But glucose isn't the only number that matters. The next test looks at something diabetes quietly damages for years: your heart. 3. Lipid panel. The third essential test is a lipid panel. This measures LDL cholesterol, bad cholesterol, HDL cholesterol, good cholesterol, triglycerides, total cholesterol. People with type 2 diabetes often develop a condition called diabetic dyslipidemia. This means high triglycerides, low HDL, small, dense LDL particles. These particles are especially dangerous because they clog arteries faster. That's why heart disease is the leading cause of death in people with diabetes. Doctors usually aim for LDL below 100 milligrams per deciliter, sometimes even below 70 milligrams per deciliter if heart risk is high. But cholesterol isn't the only silent risk. Diabetes can also damage an organ that filters your blood 24 hours a day: your kidneys. 4. Kidney function test, creatinine and eGFR. Next is a kidney function test, which measures creatinine and eGFR. Your kidneys act like natural blood filters, but high blood sugar slowly damages the tiny filtering units inside them. The problem is that kidney disease can develop for years without symptoms. Creatinine is a waste product your kidneys normally remove. If creatinine rises, it means your kidneys are not filtering properly. The eGFR calculates how well your kidneys are working. Normal eGFR levels, above 90, healthy 60 to 89, mild loss, below 60, chronic kidney disease. But here's the twist. Kidney damage often starts long before creatinine rises, which is why doctors also order another test. 5. Urine albumin to creatinine ratio. This test checks for albumin, a type of protein leaking into your urine. Normally, kidneys do not allow protein to pass through, but when they begin to get damaged, tiny amounts start leaking out. This condition is called microalbuminuria. It's often the earliest sign of diabetic kidney disease. The good news is that if caught early, treatments like blood pressure control, medication, and better glucose management can slow or even stop kidney damage. But diabetes also affects another organ many people forget about: your liver. 6. Liver function tests. SNOT. Doctors often check liver enzymes, including ALT, AST, ALP. Why does this matter for diabetes? Because many people with type 2 diabetes develop fatty liver disease. This happens when excess fat builds up in liver cells. Over time, it can progress to liver inflammation, fibrosis, and even cirrhosis. The shocking statistic is that up to 70% of people with type 2 diabetes have fatty liver. But many people feel completely normal. That's why routine blood tests are important. Now the next test surprises many patients, because it has nothing to do with sugar, but it affects your nerves and brain. 7. Vitamin B12. If you take metformin, your doctor may check your vitamin B12 levels. Metformin is one of the most common diabetes medications, but long-term use can reduce your body's ability to absorb vitamin B12. Low B12 can cause nerve damage, tingling in the hands and feet, memory problems, fatigue. Here's why this matters. Those symptoms can look exactly like diabetic neuropathy. So sometimes people think their diabetes is damaging their nerves when it's actually a vitamin deficiency. That's why checking B12 every couple of years is often recommended, but we're not done yet. Because diabetes can also interfere with something that controls your entire metabolism. Your thyroid. 8. Thyroid function. Test doctors often check TSH, the main thyroid hormone signal. Your thyroid controls metabolism, energy, weight, temperature, and heart rate. People with diabetes have a higher risk of thyroid disorders, especially hypothyroidism. When the thyroid slows down, it can cause weight gain, fatigue, high cholesterol. Poor blood sugar control, which means diabetes becomes harder to manage. Thyroid problems can develop slowly and quietly, so this blood test helps catch it early. Now the next test is especially important for your heart. 9. High sensitivity CRP. This test measures C-reactive protein, a marker of inflammation. Heart disease is not just about cholesterol, it's also about inflammation inside blood vessels. High CRP levels can indicate increased cardiovascular risk, artery inflammation, higher chance of heart attack or stroke, even if cholesterol levels appear normal. Doctors sometimes use this test to get a more complete picture of heart risk in people with diabetes. But there's still one more test, and it might be the most overlooked one. 10. C-Peptide Test. The final test is C-Peptide. This test measures how much insulin your body is producing. When your pancreas makes insulin, it also releases C-Peptide. So measuring C-Peptide helps doctors determine whether your pancreas still produces insulin. If diabetes is progressing, if insulin therapy may be needed, it can also help distinguish between different types of diabetes. For some patients, this test can completely change their treatment plan, and that leads to the most important point. Blood sugar alone does not tell the whole story of diabetes. Final recap. Let's quickly recap the 10 important blood tests every person with type 2 diabetes should know about. 1. Hemoglobin A1C, average blood sugar over 3 months. 2. Fasting blood glucose, baseline glucose control. 3. Lipid panel, cholesterol and heart risk. 4. Creatinine and eGFR, kidney function. 5. Urine albumin creatinine ratio, early kidney damage. 6. Liver function tests, fatty liver screening. 7. Vitamin B12, nerve and brain health. 8. Thyroid test, TSH, metabolism and energy. 9. High sensitivity, CRP, inflammation and heart risk. 10. C-Peptide, how much insulin your body produces. When monitored regularly, these tests help doctors catch complications early and keep diabetes under control. Because managing diabetes is not just about lowering blood sugar, it's about protecting your entire body, and the right blood test at the right time can make all the difference. If you're trying to improve your blood sugar naturally, what you eat every day makes a huge difference. That's why I created a 7-day blood sugar balancing meal plan with simple diabetes-friendly meals. You can download it at www.zenivex.co.